name is Christy, and I'm making this video for International Ataxia Awareness Day. Some of you know that my father was diagnosed around 38 years old, approximately 12 years ago, with Spino-Cerebellar Ataxia. Spino-Cerebellar Ataxia is also known as SCA, so you may hear people refer to it as SCA. What is Spino-Cerebellar Ataxia? By the way, forgive me if I look down. I wrote some notes on some cards. I want to make sure I don't forget anything. So information that I provide today will be information that I have experienced with regarding my own family and information that I've collected from the National Ataxia Foundation. So what is spinocerebellar ataxia? It is a neurological degenerative disease. Now, because it's degenerative and neurological, it affects the brain. Specifically, spinocerebellar ataxia is an inherited disease. Now, inherited diseases fall into dominantly inherited or recessively inherited. Recessively inherited requires two defective genes, one from the mom and one from the dad, in order for a person to develop the disease. However, dominantly inherited diseases only require one defective gene from one parent about it. So, symptoms of SCA2. The first symptom is usually ataxia, which is incoordination of the hands and trouble with balance when walking. Early symptoms of SCA2 often include neuropathy or loss of feeling and reflexes, and very slow eye movements. Some people with SCA2 show muscle cramps or tremors. As SCA2 progresses, difficulty swallowing and indistinct speech are very common. Other symptoms can include spasticity, weakness, or cognitive troubles. Also, SCA2 is associated and may cause a form of Parkinson's disease. What is the prognosis for SCA2? The onset of symptoms in SCA2 typically occurs when a person is in his or her 30s. In most cases, the duration of symptoms is from 10 to 15 years. It affects males and females equally. However, it can affect you at an earlier age. It can affect you as a child. It can affect you in your 40s, in your 50s, in your 60s. Some people live only 10 years. Some people live less than 10 years. Some people live more than 15 years. My grandpa was affected, and he lived to be 83. From what my family has said is that he showed symptoms in his 40s, but he lived to be 83. So obviously he dealt with those symptoms and he dealt with that disease for a very long time, more than 15 years, more than 20 years. As for my father, he was diagnosed around 38. I feel that he showed symptoms in his 20s by being clumsy. He's now 50. He's in a wheelchair. He cannot walk at all. The disease he has a more severe form of the disease. That leads me to tell you that SCA, there's this thing called anticipation. And what anticipation is that if you have a parent who has the disease, if you develop the disease, it is very likely that anticipation will take effect. And that means that you have a higher chance of having a more severe form of the disease. You can show symptoms at an earlier. So, symptoms my father showed. Early symptoms that I can remember were clumsiness, incoordination of hands and movement, lack of balance, muscle cramps, especially the muscle cramps. I remember my mom used to massage his legs because he would get these cramps that would not go away, and there was nothing that he can take to get rid of them. At the time, he maybe didn't have anything. He had a slower speech than the average person. It wasn't so slow where he sounded, like something was wrong. but he was able to tell that his speech was slower than the average person. As time went on, he lost more balance, had a more hard time of walking. He had to walk with a wider gait to maintain his balance. He had double vision, type of stuff. As the years went on, his eyesight got worse. And right now, he can see with glasses, but he has a very, very strong prescription. So, like I said, my dad was diagnosed around 38. He's now 50. He's in a wheelchair full time, and it's terrible. It's awful because my dad was in the military. He's an Army veteran. He served in the Gulf War. So how can you help? How can we help? How can we get more research? We can do this by raising awareness. Raising awareness can mean talking to schools, telling your friends, telling your family what ataxia is, how devastating of a disease that it can be. Go to the National Ataxia Foundation, ataxia.org, and it'll show you on their website how to donate to their organization. Research funds will go to ataxia research. Well, thank you for watching this video. I hope I educated some of you with what this disease can do to people, what it is, how my family is affected by it. If you have any questions, let me know, and I will be sure to answer them. Thank you.